Welcome to today's Explainer. We're diving into a terrifying life-or-death medical emergency you need to know. Picture this, a patient in the ER screaming that their chest is literally tearing apart.
Now, this isn't your standard heart attack. Treating it like one, that could be instantly fatal.
It's called an aortic dissection. The largest artery in your body is tearing from the inside out.
And the onset is never subtle. It hits instantly with just brutal, violent force.
Patients usually describe a crazy, ripping pain shooting straight through to their shoulder blades.
So, how do we find the hidden clue that separates this from a normal heart attack?
The secret? You've got to check the blood pressure on both of their arms at the exact same time.
A massive pressure gap between those arms is your biggest red flag. It means blood flow is asymmetrical.
If you see a stark contrast, like 160 versus 120, it almost guarantees a massive internal tear.
To quickly confirm this deadly diagnosis, a CT angiography is absolutely your golden test. Once confirmed, hospitals jump into a strict, immediate, three-step action plan to save that patient's life.
First up, IV Labetalol. This drops the heart rate so the vessel doesn't tear more before surgery.
Next, rush them straight to major surgery. With a tear like this, time literally equals survival.
So, if someone collapses today with that distinct tearing pain, will you be ready to save them?